I'm Jonathan Mayito. I am an internal medicine specialist with special interest in infectious diseases. I am currently a PhD student at Makerere University. During my studies, I'm going to be working on a project on latent tuberculosis. Latent tuberculosis is that state where an individual has the bacteria that cause tuberculosis in their body, but they are not showing any signs and symptoms of active disease. The challenge to the science world today is that we don't know where TB hides during this latent state of infection. And therefore, the tests that we use to diagnose latent tuberculosis have very low sensitivity and very poor prediction of who will progress from latent to active infection. However, we've identified that stem cells are those cells that give rise to all the cells in the body. I would say they're the mother of all cells in the body. They have some special characteristics that make them a target for TB to hide during latent infections. We will approach household contacts of confirmed TB patients. And the reason we're targeting this group of people is that they have the greatest risk of having latent TB infections. We will ask them to donate 100 ml of blood. And once we have this 100 ml of blood, we'll process it to isolate all the white blood cells in this blood. Once we have the white blood cells, we will sort out all the stem cells from the white blood cells. Once we have the stem cells, we will extract their DNA and then identify and quantify any TB DNA that may be mixed with the DNA of the stem cells. If the results of this study are successful, this will pave way for developing a test that can be used to diagnose latent tuberculosis and also monitor response to the treatment for latent tuberculosis. If we are able to achieve this, it will help in scaling up treatment to about 1.7 billion people in the world that are thought to have latent TB infection. And if we are able to do this, it will move the control program closer to eliminating tuberculosis as a public health threat. I'm very indebted to Thrive because Thrive has provided this opportunity for me to have these PhD studies. Thrive has enabled us to reach out to the community where we are doing these studies, which has not been a norm with us scientists. We feel that now by getting to the community and explaining what we are going to do, the community will take this opportunity to contributing something to developing a new test that can be beneficial to the whole community.